Welcome to the Department of Education's training on bloodborne pathogens. The Hawaii DOE is committed to providing a safe and healthy work environment for our entire staff. The following Exposure Control Plan, or ECP, is provided to decrease or eliminate the possibility of an employee contracting disease spread through blood or other potentially infectious materials, also known as OPIMs. The best way to eliminate fear and prevent illness and disease is to understand how bloodborne pathogens like HIV and hepatitis B are transmitted and what precautions you can take to avoid infection. The Occupational Safety and Health Administration, or OSHA, established the Occupational Exposure to Bloodborne Pathogens Standard. All of the requirements for this standard can be found in Title 29 of the Codes of Federal Regulations 1910.1030. Employers must ensure that their workers receive regular training that cover all elements of the standard. The training must be offered upon employment, at least annually thereafter, and when new or modified tasks or procedures affect a worker's occupational or job-related exposure. The updated Exposure Control Plan complies with the standard regulation and clarifies the definition of regulated waste, specifies the procedures for the disposal of regulated or infectious waste, clarifies what is allowed as regular solid waste disposal, establishes the use of red biohazard bags, biohazard labels, and biohazard disposal containers, specifies the record-keeping requirements for training records, medical records, and Sharp's injury log, removes the clause relating to public health nurses, and creates a site-specific information sheet and map. Everyone has a role to play in the administration of this program. Employees must comply with the procedures and work practices outlined in this Exposure Control Plan. Principals and designated administrators are responsible for the implementation of the Exposure Control Plan at the worksite. For specific details on the administration of this program, contact your school principal or designated administrator. For your protection, all employees need to be informed about bloodborne pathogens and the need to avoid or otherwise protect themselves from transmission risks in the work setting. Bloodborne pathogens are microorganisms capable of causing disease and may be present in human blood, blood products, and other potentially infectious material. Other potentially infectious material include, but are not limited to, semen, vaginal secretions, saliva contaminated with blood, unfixed tissue or organs, such as broken or torn skin, body fluids with visible blood present, and situations where it is difficult or impossible to differentiate between body fluids. In order for a person to contract a bloodborne disease, the pathogen must be present in sufficient amounts and have an entryway into the bloodstream, like through non-intact skin, non-intact mucous membranes, when affected blood or blood fluids are splashed into a cut in the nose or mouth, parenteral access via a needle stick or an injection by a contaminated needle, sexual intercourse, and prenatally from mother to child through the placenta. Bloodborne pathogens like HIV and hepatitis B are not transmitted through casual contact like sneezing, shaking hands, and using public restrooms or drinking fountains. The human immunodeficiency virus, or HIV, is one type of bloodborne pathogen. HIV specifically attacks the T cells of your immune system. Gradually, the HIV destroys so many immune system cells that the body can no longer effectively fight infection and disease. This final stage of the infection is known as acquired immune deficiency syndrome, or AIDS. Not everyone with HIV advances to AIDS. As of now, there is no cure for this disease and no vaccine to prevent infection. There are federal and state protection laws requiring the inclusion of HIV-positive students. Students with HIV cannot be denied access to school. In accordance with Hawaii Revised Statutes 325-101, all health information regarding an individual's HIV health status, whether written or verbal, shall be treated with strict confidentiality. Persons informed of a student's HIV status may not disclose this information to anyone without specific written consent of the parent or legal guardian. Violation of this confidentiality may be subject to financial penalty. Although HIV has been more publicized, Hepatitis B has a greater prevalence. Hepatitis, which means inflammation of the liver, reduces the liver's ability to process nutrients, fight infection, and filter blood. Hepatitis B signs and symptoms range in severity, from a mild illness lasting a few weeks to a chronic lifelong ailment. For those at risk of occupational exposure, the Centers for Disease Control and OSHA recommend receiving the hepatitis B vaccination. The DOE has established 3 categories of employees at risk for bloodborne pathogen exposure in the workplace. This list of tasks and procedures, or groups of closely related tasks and procedures, may lead to occupational exposure for employees in job classification categories 1 and 2. Refer to Section 1 of the Exposure Control Plan for specifics. All employees in Category 1 perform tasks or procedures that involve exposure risks to bloodborne pathogens in the work setting. In Category 2, some employees have job classifications with risks to occupational exposure. Each school or office will identify teachers and educational assistants who are regularly and routinely exposed to students with bodily care and cleanup needs, or serve students with behaviors that present a risk of transmission. These Category 1 and Category 2 employees need special training in universal precautions to prevent occupational exposure. Category 3 employees have no tasks and work assignments involving occupational exposure. Category 3 employees should seek additional assistance to clean up or address situations involving blood or other potentially infectious material. Except for the specific jobs identified in Categories 1 and 2, all other employees of the DOE fall within this category. Please note, part-time, temporary, contract, and per diem employees, as well as volunteers, must also be aware of the bloodborne pathogen standard and view this video. DOE employees in job categories 1 and 2, including substitutes, part-time, temporary, contract, and per diem employees, will be offered the vaccine series, free of charge, or be required to sign a waiver acknowledging their refusal. Hepatitis B vaccinations must be offered after the employee has received the required bloodborne pathogens training and within 10 days of initial assignment to jobs with occupational exposure. If in doubt, an employee should consult his or her personal physician before deciding to take or refuse the vaccine. Universal precautions is a prevention approach to infection control. Employees must know how to use universal precautions to prevent exposure to bloodborne pathogens. For your protection, consider all human blood and other potentially infectious material as possibly infected, so practice universal precautions at all times. Contact with bloodborne pathogens only pose a risk to you if it can enter your bloodstream. Some potentially dangerous situations may not be as obvious as an accident involving blood. For example, it is not uncommon for a sick child to vomit at school. Since there is a slight possibility that the vomit contains some blood, a risk of exposure is created, although rare. Your skin is the first line of defense. When unbroken or intact, it is your best barrier against infection. Both the hepatitis B and HIV virus appear to be incapable of penetrating intact skin. Use universal precautions to handle any situation where there is a potential risk of transmission. The universal precautions procedure is always the same. Use appropriate personal protective equipment, like gloves and eye protection. Disinfect the area. Properly dispose of infectious waste, and wash hands thoroughly, even if gloves were worn during treatment of the injured and cleanup. If you come into contact with blood or other potentially infectious material, the most important step is to first wash your hands thoroughly with soap and water. Hand washing is easy to do, and it's one of the most effective ways to prevent the spread of many types of infection and illness in all settings. Use liquid soap if available. Bar soap is not recommended, as the bar can carry germs to others. If soap and water are not available, use an alcohol-based sanitizer that has at least 60% alcohol. For more information on hand washing, visit the Centers for Disease Control website. When responding to an exposure incident, follow the universal precautions and work practice controls to minimize your risks of exposure. There are some common areas of exposure in the school setting. Provide first aid as necessary and always practice universal precautions. In response to accidental cuts or minor accidents, put gloves on before treating the injured. Gloves provide an effective protective barrier from any blood or other potentially infectious material. Check the gloves for punctures or holes. A small cut or open sore provides an entryway for a bloodborne pathogen to get absorbed into your bloodstream. If gloves are unavailable, give the injured person several tissues, paper towels, or other absorbent material. Instruct the person to apply pressure on their own wound to stop the bleeding until proper medical care can be provided. Certain bloodborne pathogens, like the hepatitis B virus, can live for days outside the body and still cause infection in dried blood. To prevent infection and cross-contamination, all equipment, environmental and working surfaces shall be cleaned and decontaminated as soon as possible using an EPA-approved disinfectant. The following disinfectants may be used: isopropyl alcohol, sodium hypochlorite, such as Clorox or Puree, which is diluted 1 part bleach to 10 parts water, or any EPA germicidal solution mixed according to the manufacturer's directions. To disinfect a contaminated surface, first put on gloves. Check it for any holes and replace it if necessary. Next, spray the disinfectant on the contaminated surface and allow several minutes for the disinfectant to work. Wipe it dry with paper towels or wipes and properly dispose of any contaminated materials. Items that may be contaminated should only be picked up using mechanical means, like a brush and dustpan or tongs. Clean and disinfect such implements and bins or pails that were used during cleanup. Even if gloves are worn for the treatment of the injured and during cleanup, remember to finish with effective hand washing and drying. DOE employees may be exposed to bloodborne pathogens present in regulated waste. Regulated wastes are materials that are liquid, semi-liquid, or other potentially infectious material. Contaminated items that would release blood or other potentially infectious material in a liquid or semi-liquid state if compressed. Items that are caked with dried blood or other potentially infectious material and capable of releasing these materials during handling. Contaminated sharps like syringes and EpiPens. In order for schools and offices to be compliant with HIOSH regulations, they must be equipped with red biohazard bags, biohazard labels, covered biohazard disposal containers with biohazard warning labels attached, and red sharps disposal containers. Each school is responsible for maintaining their own supply of these materials. Failure to do so may subject the school to HIOSH and State Department of Health citations and financial penalties. Not every classroom needs a red biohazard bag. The red biohazard bags and labels only need to be in a central location where regulated waste is kept until disposed of, such as the health room. Red biohazard bags are to be used only for disposing of materials containing regulated waste or other potentially infectious material. Biohazard labels are only used on other sealed containers or bags which contain regulated waste or other potentially infectious material for disposal. So, how do you dispose of regulated waste? All regulated waste material must be placed in a red biohazard bag or a sealable bag or container labeled as biohazardous. The red bag or container must be sealed and placed in the covered biohazard waste container for proper disposal. All red biohazard bags or items labeled as biohazardous are required to be disposed of by a licensed contractor and may not be placed in regular trash for disposal. Doing so may subject the school to citations from HIOSH and the State Department of Health. OSHA does not generally consider feminine hygiene products, Band-Aids, or bandages as regulated waste. According to the State Department of Health, these items may be disposed of as regular solid waste. Schools will be responsible for contracting their own state-licensed vendor to properly dispose of their regulated waste. When handling sharps disposal containers, refer to the OSHA fact sheet, protecting yourself when handling contaminated sharps. Contaminated sharps should be discarded immediately in containers that are closable, puncture-resistant, leak-proof on sides and bottoms, and appropriately labeled or color-coded. Please see the school or office site plan for the location of sharps disposal containers. In the event of an exposure, employees and supervisors must follow the post-exposure incident procedures in Section 4 of the Exposure Control Plan. An exposure incident is defined as a reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious material that may result from the performance of an employee's duties. So what are your responsibilities in responding to an exposure incident? If you have possibly been exposed to blood or other potentially infectious material, seek immediate first aid or wound care as needed. Cleanse the area of exposure with soap and water, then rinse thoroughly with water. Contact your immediate supervisor and complete the employee exposure report immediately. Your principal or supervisor can provide assistance on the completion of forms. Post-exposure evaluations and follow-up are provided free of charge to employees. Obtain confidential medical evaluation and follow-up by your attending physician or healthcare professional who will need to perform several activities involving documentation and testing. The principal or administrator must obtain essential information and complete Form UP 110. Provide the employee's healthcare professional with proper documents. Advise the employee on required forms for the physician. Prepare Form WC1, Employer's Report of Industrial Injury, if the employee was absent from work more than 1 day or requires medical treatment beyond ordinary first aid. And investigate the exposure incident and complete Form UP 100 regarding the exposure incident to refine or improve the exposure control plan at the school or office. The school or office must also maintain worker records, a sharps injury log, and training documentation. In closing, the exposure control plan is meant to prevent on-the-job employee exposure to bloodborne pathogens through the practice of universal precautions, implementation of engineering and work practice controls, and use of personal protective equipment. To provide a continual program of orientation, training, and procedural compliance, and to ensure prompt follow-up care of employees exposed to another person's blood, body fluids, or other potentially infectious materials while performing work-related tasks. The overall goal is to keep you healthy and safe. Consult the DOE Bloodborne Pathogens Exposure Control Plan and review the frequently asked questions. If you need further assistance, please contact the Safety, Security, and Emergency Preparedness Branch at 586-3457 or send an email via Lotus Notes to safetyhawaii@notes.k12.hi.us. Mahalo for watching this training video.